brothers, meaning that from an early age, my life was about fighting injustice. My brothers tease me no end, and for that I am eternally grateful. Since the age of 2, I've worn glasses. My brothers used to call me Four Eyes. That's what kids in England get called when they wear glasses. Apparently, it was to toughen me up before I hit the scary world of my first school days. Life is tough out there, and they did well. They taught me to fight what isn't right. I spent 10 of my 19 years as a nurse working with Mercy Ships here in Africa. Mercy Ships is a surgical, non-governmental organisation that operates the world's largest hospital ship, the Africa Mercy. We've provided free surgery to the people of sub-Saharan Africa for over 20 years. During my time, I've learnt so much. And one of the most profound, that transformation is possible. It takes courage, it takes daring to believe that something more than meets the eye is possible. But I have seen it over and over and over again. I've seen it in people's physical beings, but I've seen it in people's hearts and minds as well. Sometimes transformation happens when it seems impossible. Sometimes beauty is crafted in the most challenging of circumstances. Sometimes transformation happens and is birthed through the magic of a simple idea. According to The Lancet, one of the world's leading medical journals, 5 billion of the world's 7.5 billion people lack access to safe, affordable, and timely surgery. 5 billion. That's 2/3 of the world's population. Imagine 2 out of every 3 of you in this room wouldn't get the care that you needed. I've seen it firsthand, and likely you have too. Just a few weeks ago, I was traveling in Madagascar. Picture me, white girl, extreme heat, wearing a skirt, heels, looking all fancy, topped with surgical hat, mask, and shoe covers. It's a good image, isn't it? I looked ridiculously out of place. I was there to observe surgery. A mother in obstructed labour was wheeled into the operating room. She lay still and flat, with dark brown eyes, wide open. Her baby had been trying to get out for many, many hours, and it was decided that she needed emergency surgery. She needed a cesarean section. In Madagascar, it's hard to get to a hospital. Just a few days before, I'd heard of someone being carried 87 kilometres on foot to reach surgical care. 87 kilometres on foot. That's 54 miles being carried to safety. The young mother lay waiting, exposed, vulnerable, and alone. I'm from England, where healthcare is free and available to all, so I was wondering, why the wait? What was taking surgery so long to begin? And then it dawned on me that her family must have been busy outside, gathering the money to buy the supplies that were needed for her surgery. This is not normal in 1/3 of the world, but this is typical in countries where surgery is hard to come by. Finally, a brown cardboard box arrived with the supplies that were needed for surgery. The young mother gracefully bent forward as the anesthesia provider gave her her spinal anesthetic. The blue drape hid her face, and as she lay behind it, the team began to do the emergency surgery. After just a few minutes, the baby was out, and I heard a cry. I could feel the relief in the room. All was well with this precious baby girl. I was there to observe the team in action, and they did a fantastic job. I saw some equipment that we had donated, and it measured the mother's oxygen levels to give the team a warning sign if anything was going wrong. A small thing, but huge in the big picture of safe surgery. Small but magical ideas can have life-changing impacts. Despite the challenges, the mother had accessed the surgery that she needed. It doesn't always end like this, but that day, one life, if not two, had been saved. In 2014, The Lancet commissioned a team of experts to look at the state of surgery in low and middle income countries and to set goals for where it should be by 2030. And what they agreed is that what the world deserves is universal access to safe, affordable, surgical and anaesthesia care when they need it. I've already told you that 5 billion people in the world don't have that sort of access to surgical care. There may be an operating room, but the equipment might not work. The equipment might work, but they might not be able to afford it, or they might not be able to get to it in time. Because maybe there isn't even a road. And that's one of the difficulties of fixing surgery. To fix surgery, you can't just build more operating rooms or train more surgeons. To fix surgery, you need to fix everything. You need to fix the water, you need to fix the electricity, the infrastructure, the training, the biomed technology. It's a really complex thing to do. And that's probably one of the reasons why surgery hasn't been on the agenda until now. At Mercy Ships, we are very well known for our life-transforming surgery provided to those who otherwise couldn't access it. Sambani, 7.46 kilograms of tumour. It should not exist. It is not acceptable. Sambani should have accessed the surgery he needed some 36 years ago. We did his surgery because we care and because we can. But what is not as well known is our desire to do ourselves out of a job. Our vision is to support and strengthen the surgical health systems in the countries in which we work, from grassroots to government level, in the most impactful way we can. We do that by coming alongside the local health system and providing high-quality medical education programs, like courses and opportunities for professionals to work alongside experienced surgical providers. As well as that, we work with the hosting government to help influence policy, including the development of a national surgical plan. We want stories like those of Sambani to come to an end. As I said, fixing surgery is not easy. For the mother awaiting an emergency delivery, the solution is complex. Sometimes it requires large investment, and when it lacks, the cost to life is catastrophic. At worst, death, or damage to tissues that cause constant leaking of urine. And at best, there is no best. It is not acceptable. And yet, the fixes don't always come at huge cost. Sometimes it comes down to implementing a simple tool. And that's why one of our projects has been such a huge success. The Surgical Safety Checklist produced by the World Health Organization is a simple tool and yet has the power to dramatically affect safe surgical practice. The checklist includes a series of simple steps, from checking that you've got the right patient to checking that you have the blood that you might need in an emergency, and to check that you haven't left anything behind in the patient, like an instrument. Simple. And yet this tool has been shown to reduce mortality and infections by up to 47%. 47%. and infections by nearly 35%. Similar studies since 2009 in the United States, Europe, and Africa have reported similar results. In fact, in Madagascar, just a few weeks ago, one hospital told me that their infection rates had dropped from 28% to 14% since they had started using this tool after the training we had provided in all of their regional hospitals. And we want to see the same here. And so we've introduced the checklist to 36 hospitals nationwide. Our desire is that it will dramatically affect surgical practice and make surgery safer here in Benin. And what I love about transformation is that it multiplies. By making surgery safer in one hospital, and then another, and then another, a whole nation can be changed. How can something so simple make surgery safer and save lives? The surgical safety checklist is a magical idea. At Mercy Ships, we are very used to seeing huge tumours and believing that there is more than meets the eye. We see beauty, we see potential, we see lives that have been created to be lived. We believe that transformation is possible. We see it every day, not just in individuals, but for nations. And we want to be part of it. We believe that it is magical. And one day, we want to do ourselves out of a job. Surgery accessible for all 7.5 billion people in the world. Imagine. Let's face it, we're all four-eyed little girls in some form who want to be seen for who we are, who want everything to be fair, for justice to be done. For me, my passion is healthcare. What is yours? Do you have the courage and vision it takes to believe that you could be part of multiplying the magic of an idea?